Hi, this is Dr. Gorenberg, and I wanted to demonstrate to you, the members of our practice, how we do the allergy skin tests so that everybody can do this in an equal and consistent way throughout the practice. We use the DuoTip, which is this little device, which is like a two-headed toothpick. Let's get a nice close-up of the tip of this. Can you see that?
Kind of.
Okay. Now when we use the DuoTip, this does not need to be rotated or manipulated into the skin. The idea behind this is, over here, the idea behind it is that we will put it on the skin to dimple the skin and then flick it to the side, which will make a tiny scratch like this. So the feeling that you want when you use the DuoTip is to put it on the skin, you'll feel the tip catch, and then you flick it to the side. So the expression that it's all in the wrist really applies here. Okay? Now, let's take a look at the patient's back. We do the allergy test on the back usually, and you can see that I've numbered this nice patient's back here. I had a little bit of trouble numbering the third column, and so there's a little bit of redness there because I had to go over it a couple of times with the pen. That's probably because I didn't use enough alcohol when I cleaned that spot. So we wash the back with alcohol to get the oil off, and then normally we just use a ballpoint pen to mark the skin. The ballpoint pen is easy to clean. With alcohol, it normally comes right off. It's easier to use that than the skin marking paint brushes that are used for things like surgery. The other thing I would like you to notice about the way I've laid this out is that the skin tests are spread out. You see this? We don't want them too close together. I've used quite a bit of space there so that everything's nice and spread out so that the reactions can be viewed individually because we don't want them to run together. So I left approximately an inch between the individual tests so that we would have plenty of room. And I've also left at least an inch between the tests going side to side so that those also won't run together from the sides. Okay, so let me hand this back to you and we'll just take a quick look at how we put the test on. The test tray is normally loaded from the right side to the left side. And the reason we do that is because people who are right-handed will normally draw the tips from the right-hand side. And then as they take those out, they get the ones moving over to the left. And that way they're not reaching over the tips, which might cause them to knock them out or actually bump them and flip them into the air. For left-handed people, this can be a little bit more awkward because they're going to be reaching over, and so they have to be more careful. In offices where the people who do the test are strongly left-handed, they might prefer to load the tray the opposite way. It's very important, though, that if the tray is loaded the opposite way, that we also change the label of the top of it and make sure that the start, where it shows that we start with the histamine control, is also relabeled. So relabeling the tray for left-handed people is acceptable, but it's got to be clear to everybody how the tray is labeled so we don't get it mixed up. So now let's take a look at doing the actual test. I do them one at a time. I know some of the staff who get used to this and do it quickly do it a couple at a time. You can see if you get a close-up of that or take a look at this that it takes a very little bit of allergen in between the two tines for doing a test. We just put this on the skin at the end of the line where the number is, dimple the skin, and then flick it to the side. Okay, so if you could get in here and zoom in on this one. So again, it doesn't take rotation. We just put it on there and then give a little flick so that we feel it catch. And that's all it takes to do the test adequately. Okay, so no rotation, which is painful for the patient and can cause bleeding. And also, you don't want to just, what we don't want to do is just do like a poke and then take it off. That doesn't achieve our goals. Okay, so we want to put it on there and then flick it to the side. Okay, so I'll go ahead and finish up this row here. It's also handy to have a wastebasket nearby at your at your right hand, so that you can just drop these right into the trash. They don't need to go into a sharps container because these would not normally puncture someone's skin if they just like picked up a trash bag. Plus, the allergy test is considered to be, of course, done properly. The epicutaneous or scratch test is considered to be bloodless in that it's just making a little scratch on the surface of the skin. Okay? Alrighty. Well, I hope that gives you a good demonstration of how we want to do it. If you have any questions, please direct your questions to me, and we'll also be implementing proficiency testing in the practice with the various staff who do the allergy tests to make sure that the tests are coming out in a consistent way. Thanks very much for watching.